Confirming positive rapid tests. How will Australia keep track of case numbers, or are they effectively redundant now? Also, would you consider rapid tests with a QR code so those results can be lodged?
States are now working on a process for reporting where they move to rapid antigen tests, which are being done at home. But as I said yesterday, the most important call to make is to your doctor. Case numbers are less the issue. It's connecting to care that is the issue, and the Commonwealth provides the telehealth support for people to be able to do that and to get advice on how they can manage their infection at home, and should matters escalate, then obviously to seek further assistance. So what matters first is the people who have COVID, the care that they get connected to. Case numbers, as whether it was Professor Kelly yesterday or other premiers and chief health officers have noted, case numbers will be underestimated in Australia because we know that people are self-managing in many instances. They haven't gone for a PCR test, they've been aware they've got COVID and they've just stayed home and they've isolated. We do want to ensure that we can get as much information as we can, because that supports the state and territories to plan for their hospitals, and that's what they're working on now to ensure that they can have effective reporting mechanisms that can, as we move more from PCR tests to RAT tests, to enable that to be informing their decisions and, of course, assisting us with ours.
That work from the states will take, and is it the position, just to clarify National Cabinet's position from yesterday, while states are still working on how to record confirmed rapid test results, will PCR tests still be used in the meantime until that work is done? The ACT Health Minister indicated this morning that would be the position in Canberra.
Yeah, what will occur is, particularly over the next couple of weeks, I would expect that those testing lines, they'll be predominantly still be doing PCR tests. And that will ensure that those test results are going back into the system, as you would expect. And given the supply issues over the next 2 weeks, that's what I would expect to occur in the majority of cases. But that gives the states a couple of weeks to get this other system in place, and that's what I anticipate that would occur. That doesn't have to be the same in every state and territory. They have their own systems for doing that. I don't see the need to impose that on them. They can work that out. They have very capable people who I think can connect all of those. And so whether they want to do it through QR codes or other systems, they're all the things being considered.
Treaty Minister. Given the rise in case numbers, just back to Mr Djokovic, can you confirm that he sought to rely on previous infection to COVID-19 to secure the medical exemption? And then secondly, the Serbian president has said Mr Djokovic has been harassed through the treatment of this situation. How damaging is this for Australia's reputation internationally?
Well, I don't believe it is at all. Australia has sovereign borders and clear rules that are non-discriminatory, and as so many other countries do. It has nothing to do with those issues. It just has to do with the fair and reasonable application of Australia's border protection laws. It is not appropriate for me to go into Mr Djokovic's own medical history. That would not be a fair thing for us to do. They are matters for him to discuss in terms of his own medical history. But all I can say is that the evidence for medical exemption that was provided was found to be insufficient.